Hi and good afternoon to each and everyone. Here I am Mrs. S. Sumiye, Associate Professor, HOD of Department of Fundamentals of Nursing, Faculty of Nursing, Rama University. Dear all, here I am today to explain about regarding admission and discharge procedure. So admission and discharge procedure is one of the very important procedure when a patient entered into the hospital. So today we will discuss regarding the admission and discharge procedure. See here, before talking regarding the admission and discharge procedure, we have to talk about the nursing. So nursing is nothing but nursing. It is a profession which encompasses and collaborates with all the other departments, and also it provides the care to all the ages and in the communities. The main aim of the nursing is to promote the health and prevent the illnesses. The main aim is to promote the health and prevent the illnesses and care for dying and ill people. So this is about regarding. So here nursing, it encompasses all the nurses or the one who plays a major important role in a admission and discharge procedure. Next, if you talk about regarding, we have to talk regarding the hospital. So what is in a hospital? Hospital is nothing but hospital is a place where it is an institution where the investigation, treatment, medical, surgical and all the procedures will take place, where the patient can stay for his treatment and to alleviate the disorders. Hospital is a place where all the people can able to get the treatment for the disorders. Next, we'll talk about the admission procedure first. What is the admission? We might have listened this word in many other aspects. So here admission is nothing but allowing a patient to stay in an institution. So when it comes to the health, so admission is nothing but allowing a patient to stay in the hospital for the treatment purpose, for investigation purpose and for a therapeutic purpose. Who will be staying in a hospital for more than 1 or 2 days, any day, how many days, if for any treatment purpose or investigation purpose, we will call it as an admission. So here coming to the, what is the purpose of admission? Admission procedure is nothing but allowing a patient to stay in a hospital that where the doctor and nurses are cared by the people. Who will be taken care means here nurses and doctors are the people who will be look after the patients. So in that institution we will call it as that process we will call it as an admission procedure. So here what is the purpose of admission? So mainly what is the purpose of admission is nothing but to provide the treatment to the ill persons and also to know the exactly what was happening in the patient health, and also here to know the to investigate the disorder, which is to identify the any disorders and to provide therapeutic treatment to the patient. The main purposes of admissions here are, that is to provide the treatment and also to alleviate the disorders and also to know the exact cause for what is happening in at present situation in a patient body. Next come to here, if you talk about the types of admission, there are 2 types of admission. One is routine admission . Second one is emergency admission. There are 2 types of admissions are there, that is first one is routine admission and the second one is emergency admission. Whereas routine admission means here where the patients are treated for their problems will to identify the what was the problem. Here mainly focusing on the present problem of the patient. The problem the patient will let us know what is happening, for identifying any disorders like hypertension, diabetes, this type of any for investigation purpose or for treatment purpose. If any person is admitting in the hospital, we will call it as a routine admission. Whereas emergency admission, it is an emergency admission means in the name itself it is there, that is if any patient is admitting into the hospital for with any acute disorder in an emergency situation, that we will call it as a emergency admission. So in which emergency admission, like for example road traffic accident, poisonous cases, suicidal attempt cases, this type of cases we will call it as an emergency admission where the patient need to be treated in an immediate effect. Whereas in a routine admission for the patient, based upon the patient problem, we will do the investigation and we will provide the treatment. For that purpose, we will make the patient to stay in the hospital. Whereas emergency situation, patient will come with any emergency situation, like for example, road traffic accident, as I said you, that is poisonous cases, suicidal cases, etc. This type of admission, we will call it as an emergency admission. Next, we will call, if we see the admission procedure, like before, after having the admission into the first main responsibility of the nurse is the unit and its preparation. Unit preparation is the very, very important. It is done by the nurse. Unit preparation is nothing but you have to clean the, like we have to do the bed making, and also side table, everything is ready, and treatment table is ready, and next one is the patient privacy. The next one is patient privacy, and we have to see that ventilation for the patient and everything we have to see, and what all the equipments are there near the patient table, all the equipments are working well or not, we have to see. Then we have to, after preparation of the unit, then the real admission procedure will start. The real admission procedure in the sense that is, here once the patient comes, then only the patient comes to the our ward, then only the admission procedure will start. See here, when the patient comes first, immediately the nurse has to meet the patient and greet the patient. Here the nurse has to meet the patient and greet the patient and welcome the patient to our ward. Then here, after welcoming the patient, we have to start with our a routine examination. The routine examination includes history collection, physical examination we have to do. So after collecting the history collection and physical examination, thus any treatment plan is there to the patient already written by the doctor. That treatment we have to be given. Then after that, we have to orient the patient to the hospital settings. So orient the patient means orient the patient to the hospital setting. Here we have to show the patient that is what is a visitor's timing, what is a visitor timing, when the doctor will come, and where is the treatment table, and also who is the nurse in charge of the ward, where is the drinking water facility, food where it will be provided, and also the toilet facilities, hot water facilities, any facilities are there in our ward, that to be introduced to the patient in his level of understanding. Then afterwards, after meeting the patient, then here mainly there are something we have to be considered, that is there are some special considerations will be there to the patient. The special considerations in the sense because whenever a patient admitted into the hospital, immediately the one we will see, that is anxiety. Here the patient encounters the most of the anxiety because of his disease condition. He will have the already he will be very having a undue tension and stress, and also the patient here will that maybe the ward will be very new to the patient due to his disease condition. He might be have fear. So here what we have to do means, first the nurse has to make the patient to be a comfortable position, and also the nurse has to explain the patient the ward routines and everything, and what will be the treatment procedure, how it will be going on here, and everything. She has to explain with the she has to explain to the patient, and also she has to listen to the patient whatever the patient is telling. When the patient when the patient have trust over the nurse and the hospital, then it may easily the anxiety or stress will be relieved to the patient. So that is one of the special consideration we have to consider in the, as a nurse, we have to consider during the admission procedure. The next one is here, admission procedure will include the some of the steps of admission procedures are there. Steps of admission procedure. The first one is examination. Next one is orientation. Then maintaining records and reports. So here the main steps involved in admission procedure are, first one is examination, that is we have to examine, that is nothing but is a physical examination and history collection we have to do, and we have to identify the what is the problem of the patient. Then we have to orient after examining the patient, then we have to orient the patient to the hospital atmosphere and the facilities available in the hospital and everything. Then we have to maintain, as a nurse, we have to maintain records and reports. Records and reports in admission process includes, that is the admission record, next one is diet record, next one is HMIS report record, and also lab record, like a drug book. These are all to be maintained, and the vitals like temperature, pulse, respiration, and also if the patient is having any respiratory or like urinary bladder problem, means like intake and output chart, everything to be maintained, that all the records to be maintained and reported to the shift in charge accordingly. So this is how the admission procedure starts. Admission procedure involves nothing but that is the main responsibility of the nurse. The nurse has, whenever she get the information from the admission department, immediately she has to start the unit preparation. Unit preparation is nothing but preparing the patient bed, that is doing bed making and preparing the side table, removing the any excess medication or anything is there, we have to remove. Then all the equipments which is arranged near to the patient bed, whether it is all working or not, and ventilation in the unit is good or not, and privacy to the patient we have to see. Then afterwards, when a patient comes, then we have to start we have to meet the patient, greet the patient, and we have to collect all the history and physical examination, and like a baseline data we have to be recorded. After recording the baseline data, if any treatment is planned already, the treatment has to be provided. Then we have to provide the treatment orientation to the patient and also to the patient family members, and also the rules and regulations followed by in the particular ward or in the particular hospital to be explained to the patient and the family members. Afterwards, we have to maintain the records and reports. This is the admission procedure. Then later on we will see discharge procedure. So discharge procedure, when we talk about the discharge procedure is a multidisciplinary approach. Discharge is a multidisciplinary approach, means here multidisciplinary process or approach, why we have to say, means discharge involves here like all the departments has to, like the inpatient department, outpatient department, like in the like billing department, social workers, doctors, all should be like a dietitian, everybody should be involved in this. Like it is in a multidisciplinary approach where there are so many people will be involved in the discharge of the patient. So what is the discharge? Discharge is nothing but relieving the patient from the hospital setting. Relieving the patient from hospital setting means like when a patient feels that he is okay for the what problem he has admitted into the hospital, the problem has decreased, or for example he feel our patient or the doctor, if they feel that the patient can manage by himself in the home, if they feel that, immediately we can able to discharge the patient. So here discharge is nothing but there are some types of discharges are there. Discharge is nothing but allowing a patient to relieve from the hospital setting, we will call it as a discharge. There are some types of discharges there, types of discharge, that is, first one is planned discharge, the next one is Lama, the second one is, third one is abscond, the fourth one is transfer, fifth one is referral. So types of discharge, there are 5 types of discharge. The first one is planned discharge, Lama, abscond, transfer and referral. There are 5 types of discharge. When we talk about the planned discharge is nothing but when a doctor or the patient feels that the patient is well, he is reduced the disorder whichever for what he has admitted into the hospital, and also patient or doctor feels that the patient can able to manage him or herself in the home, then the doctor will write the discharge summary. After the doctor's order, then the discharge will be happening. That is, we will call it as a planned discharge. Next one is Lama. Lama is nothing but left against medical advice. That is, Lama is nothing but left against medical advice. Left against medical advice means if any patient is admitted into the hospital with any type of disorder, though he has not reduced the disorder, though he is having some issues, if he is discharging from the problem, the disease condition may worsen if he is going from the, if he is discharging from the hospital. In case of explaining all the what to say, like in case of explaining the all the ill effects of discharging at present from the hospital, though if the patient is not willing to stay in the hospital, the patient wants to discharge from the hospital against the medical advice. Here doctor says not to discharge from the hospital, but the patient says he want to discharge from the hospital. So when the patient goes against to the doctor's orders, then we will call it as a left against medical advice. When a patient is leaving against a medical advice, immediately we have here as a nurse we have to take the consent from the patient. Like consent from the patient means we have to take the signature from the patient. The consent contains the patient, like a patient problem, the what doctor advises. Though the patient is not willing to stay in the hospital, like that we have to write, and we have to take the patient name, like a patient name, like a IP number, some details will be there, and his phone number and everything. We have to take the signature, and then only we have to send the patient from the that we have to take in the consent that if anything is happened once the patient is going out of the hospital, if any ill effects are happening, the patient, the hospital is not responsible, like that we have to take a consent from the patients, that is who is going under the Lama. Next one is abscond. Abscond is nothing, in the name itself it is there, absconding from the hospital setting without giving information to the nurse or the doctor to anybody else. Next one is transfer. Transfer is nothing but transferring the patient from one unit to the another unit or one hospital to the another hospital for any investigation or treatment purpose. Next one is referral. Referral means when we are referring the from one hospital to the other hospital for any special treatment purposes, like we will call it as a referral. When a doctor is referring from the high-end hospitals, like any specialty hospital, for the purpose of his treatment or investigation purpose, we will call it as a referral. So these are all the 5 types of discharge, that is the planned discharge, Lama, abscond and transfer and referral. Whenever the Lama is there, immediately we have to take the consent from the hospital that we are not responsible for the patient if anything has been. Next, coming to the discharge planning. So discharge planning contains mainly, there are 6 steps will be involved in the discharge. 6 steps of discharge, that is the first one is evaluation, the next one is discussion, third one is planning, fourth one is determining, fifth one is like referral, sixth one is arranging. This 6th step has to be minded or followed when the discharge starts. So here first one is evaluation. So proper evaluation of the patient disease condition must be done by the doctor. So when the doctor is evaluated the patient and the doctor feels that the patient can manage by himself in the home, or the disease or severity of the disease was reduced, then the doctor can write the discharge form. Once the doctor orders are given, then we have to discuss, and discussion in the sense we have to discuss with the family members and to the patient, that is the what is the present condition of the patient and why we are going to discharge from the patient, that we have to discuss with the family members. Next one is planning. Planning means how to we have to plan here how we can able to send the patient, like it might be a transportation system, then the care after the hospital, how it will be, then we have to plan and we have to explain to the patient. And determining is nothing but determining that who will be the care after the patient, like after going home who will take care for the patient. And here if it all needed, we have to give training to the patient friends or family members for his like we have to train how to take care of the patient. Next one is referral. So referral is nothing but then when the patient has to come to the outpatient department, like how many days once he has to come and meet the doctor, like how many intervals he have to come, that referrals we have to be written. Then arranging for the transportation. See, for example, if the patient is going on transfer, if the patient is going on referral, or otherwise if the patient is having any emergency condition, or otherwise the patient needs some arrangements like transportation system to go from one hospital to one other hospital, or from one hospital to the home, or whatever it may be, here we have to arrange the transportation system. It might be an ambulance, or it might be any vehicle. So these are all the steps must be followed as a nurse. That is, we have to do evaluation, discussion, planning, determining, referral, and arranging of the vehicles. So these are all the main steps which is involved in the discharge planning. Next one is when the patient is discharging, mainly here there is a checklist to be followed. There is a checklist to be followed, that is method we will call. That is medication. Next one is evaluation and environment. Next one is treatment. Next one is health teaching. Next one is outpatient referral. Next one is diet. So here the checklist before discharging of the patient, this method we will call it as this checklist we have to be followed. That is the medication plans, that is for how many days we have given the medication, and whether it is a dose of the medication, whether it is a TD, BD, or like we have to be explained which tablet to be taken and which hour, how they have to be followed the treatment plan and all. We have to explain the patient. And final evaluation and environment in the sense like here, environment means when the patient is discharging and where the patient is going to stay in a home, whether the environment is good, like the patient family members, how they are feeling, whether they are affordable or not. That is one point. One more point is whether the patient can whether he is emotionally strong, emotionally stable, can he able to take care of himself or not, we have to take. Then treatment plan means all the treatment plan we have to explain to the patient, and also we have to tell the patient to follow the treatment plan. And also the transportation also it will comes. Transportation means like how the patient will go from the hospital to the home or one hospital to the another hospital. Next one is health teaching. Based upon the patient condition, we have to teach the health education we have to provide. Then outpatient referral, at how many days interval the patient has to come for outpatient interval, and the diet, which based upon his disease condition, which type of diet he has to be taken. These are all the checklist we have to be taken, we have to be explained to the patient. So here comes at last, if it comes to the role of nurse, the main role of nurse in admission discharge procedure is, when it comes to the admission procedure, mainly the nurse has to be follow all the treatment plan. She has to orient the patient to the hospital environment and the patient family members. Also she has to talk and provide privacies, patient ventilation, and also everything we have to be provided. We have to do the general physical examination and also history collection. Then when it comes to the discharge is nothing but relieving the patient from the hospital. There are main types of discharge are there: planned discharge, Rama, abscond, or transfer, and referral. So in which mainly here as a nurse we have to identify that here any psychological problems also arrives sometimes, any transference and counter transference we will say. So emotional stability of the person also we have to be seen. So this is how I conclude my topic, that is admission and discharge procedure. I hope you understand.